Hello, today we're going to go ahead and do insertion of an IV. Again, you want to have all of your supplies ready, your sharps container, your hand sanitizer or washing of your hands at a sink if available, IV start kit, extension tubing with cap, your flush, your proper gauge, insertion, stylet, some extra alcohol wipes if needed. What I like to take a look at is get your patient in a comfortable position. Make sure you're using a good vein. You want to make sure they're well hydrated. Something that you don't want to use is an arm that has had surgery on it, lymphedema, anything in that nature. Always start lower. So we'll go ahead and our mannequin here has a nice arm set here. Again, this procedure is an aseptic technique, so it's not considered sterile. You want to maintain nice, clean hands. So after sanitizing my hands or washing them at a sink, go ahead and put on our gloves after we go ahead and put all of our supplies onto our field. I like to get that all ready first. I like to open up my little Tegaderm, my alcohol. I've also inspected prior to doing all this what vein I would like to choose. And for this guy, I'm going to go right here in his AC, as well as the type of gauge of needle that you're going to use. We're going to use a 24 gauge 3/4 inch today. And I'm going to take my saline and go ahead and flush through my extension with my cap. We'll have to attach that once the IV is in. Flush that through. And so I'm going to put on my gloves. Always wear gloves with starting an IV. And these can be tricky with the hand sanitizer. And so we know what IV we're going to, what vein we're going to choose for the IV. We're going to go ahead and put our, make sure it's nice. Sometimes you can't see them. These we can see very nicely. Put our tourniquet on, an inch above, nice and snug. We're going to go ahead and cleanse it really well and let it dry. Okay, once your site has dried or used your 2x2 to help wipe it off, you're going to go ahead and select your vein, pull the skin taut downward a bit, and go ahead and insert at a 30 to 45 degree angle. Wait till you see blood return in the hub, then advance your catheter. You're going to go ahead and release your tourniquet. Press the button to release the needle. Put it in your sharps container. Put pressure on the back side of your distal to the angiocath to stop the blood from coming out. Sometimes it does, and that's okay. You're going to go ahead and make it nice and tight. You're going to go ahead and then check for a blood return. You get a blood return, that's great. You can go ahead and flush. Watch the skin for blanching, any pain or swelling or tenderness the client may have, and easily flushing. Once that is achieved, you're going to go ahead and clamp it. Go ahead and make sure it's nice and snug to the IV site there. Go ahead and put on your Tegaderm. Take off the paper. Remove your tourniquet. Have your tape available, like one piece along the bottom. If it's easier, you can take your gloves off as well to work. And disconnect your flush. Make sure this one's clamped, and then go ahead and arrange your tubing to your liking, and go ahead another piece of tape and any amount of tape you need to secure the device, especially depending upon where it may be in the movement. And there you have your peripheral.